presenting on Telehealth Resource Center, which is a resource website that is focused on the use of telehealth and accessibility specifically to those in rural communities, those with federally qualified health centers, and rural health clinics. I currently live in California, so I was researching on the available telehealth resources in my state. One of them is access to a patient virtual care security pamphlet resource, which basically outlines using telehealth for patients in a user-friendly way. It explains what the HIPAA laws are for privacy and security of patient health information. It explains the security measures that need to be taken for telehealth on the provider side and the risks that are involved for telehealth security. And it also details the importance of protection the patient themselves need to take when doing telehealth from home, like having antivirus software and firewalls. Another resource that I focused on was a video that explained telehealth, applying that to undocumented populations, because in the area I currently live in Sonoma County, there's a large undocumented population that works in the vineyards, and it's a great resource. It outlines how providers should be providing reassurance and rapport that it's okay to seek care from these facilities and using telehealth resources, and also provides help to that population to access these resources, because sometimes there might be limited resources available, like mobile devices that can access and use telehealth in general. And then I looked at some telehealth resources that are outside of California to get an idea of the differences between the resources that are available. One was in Georgia. They were focusing on pediatric mental health and trying to initiate a resource that would focus on mental health screening for families, group counseling, assessing services through telehealth, providing suicide and mental health awareness training, and hosting community wellness events like health fairs, which speaks to their population in comparison to potentially different areas of need. The Southwest Telehealth resource focused on their federally qualified health centers and rural health centers and their needs for their communities, which seem to focus a lot on chronic disease management. This included diabetes self-management training, advanced care planning visits, treatment for opioid use disorders, nutrition therapy as their main resources for telehealth in their communities. This information was provided through the use of a PowerPoint detailing their current telehealth availability, which also focused on things like cost reimbursement. I found a resource that was specifically aimed towards Louisiana. Even more specific was for the city of Loringer. It was about family health care of Loringer, and it focused directly on the advancements in telehealth since 2020 in this city, and how they are now providing a significant amount of services they were not previously to those through telehealth, like visits for minor illnesses, chronic disease visits, which really helps in a rural area. More people have access to healthcare in a much more accessible way. One of the main differences I saw between states, specifically regions that had a higher population versus those with smaller populations, is those with smaller populations seem to have little to no experience using telehealth prior to the pandemic, and that initiated a lot of services that were unfamiliar. places like California, we're using telehealth, but definitely in a smaller capacity. But overall, all states and regions were focusing on what their populations need, which differed definitely based off of age or income, but all of them focus on their populations that are most in need and how they can access them through telehealth. And here is my resource. Thank you for your time.